outset, I'd like to thank for this opportunity given to me to talk about hypertension. Well, I'm Dr. Raj Shekaran. I'm a physician with almost 40 years experience in the field of medicine, and I've been practicing at Coimbatore for the last 40 years. Now I was in the government service also. Now I have retired and I'm running a center of my own. My special interest is in diabetes and cardiovascular diseases. Well, talking about hypertension, now the all-important hypertension conference has just been concluded. The European Society of Hypertension Conference has just concluded. Now, all clinicians are familiar with the importance of hypertension as a comorbidity and the target organs that hypertension can damage in the human system. So it becomes extremely important to control the hypertension, to prevent the complications of hypertension, and to prevent the target organ damage. Basically, everybody should be aware that though the general practice of or the golden standard of recording hypertension is still in the office, in the physician's office, other methods like home monitoring of blood pressure and ABPM have also come into vogue. This has resulted in detecting more cases of, say, other types of hypertension like white coat hypertension or masked hypertension, etc. And so the home monitoring of hypertension is one of the important armamentarium in the physician. And this helps to find out patients who are dippers and non-dippers. We all know that it's extremely important for the blood pressure and the pulse rate to dip in the night time, and non-dippers are at a higher risk of developing cardiovascular diseases. So these home monitoring and ABPM have gone a long way in finding these things out. And in most of the cases where it's difficult to manage hypertension, one must always suspect involvement of other organs like, say, kidney. So kidney plays an important role in the management of not only the blood pressure, but also the electrolytes. Similarly, one of the important target organs of hypertension is heart, the brain, the kidney, the eyes, etc. So, I mainly deal with patients in diabetes because basically I'm a diabetologist. So, in patients with, say, kidney disease, chronic kidney disease, at later stages, it becomes more important to maintain the blood pressure rather than the glycemic control. So, more importance is given to controlling the blood pressure. And the latest conference, the ESH, not much changes have been made. The method of taking blood pressure, the values of blood pressure, etc., have not been changed much because They don't want to confuse the physicians and create more complications in diagnosing and treating. The only main importance that has come into the recommendations is that the beta blockers have come once again into the forefront. Previously, the beta blockers have been pushed to the third or fourth place in the management of hypertension. But the latest guidelines say that the beta blockers can be used even as a first stage drug, especially if there's an indication, special indication. So that's one of the main changes that has come into fore in the latest conference on hypertension. And all drugs, now so many drugs are available in the treatment of hypertension. So still the calcium channel blockers are, and the diuretics, they play an important role in the isolated systolic hypertension, which is very common in the elderly people. In the young people who have high adrenergic activity, probably beta blockers still have a role to play and so should not be ignored. Then, of course, in patients who already have an established coronary artery disease or angina or a post-CABG or a post-PCI, in such patients, beta blockers have to be used. And another place where beta blockers are indicated is for the patients who have heart failure. In patients with heart failure, one of the life-saving drugs, one of the 4 life-saving drugs is still a beta blocker. Of course, there are other drugs like RAS blockers or ARNI or an MRA blocker, MRA like lacilactone, etc. Such drugs are very important. They are life-saving. So all these things have to be taken into consideration. The comorbidities, the age of the patient, the existing comorbidities of the patient, etc., have to be taken into account. For instance, if the patient is a diabetic, then an ACE inhibitor or an ARB is a must. And another thing is, most of the diabetic hypertensives require more than 1 or 2 or even 3 drugs for the control of their BP. And once again, if the first 3 drugs, that is an ACE inhibitor or an ARB, a diuretic, or a calcium channel blocker, if all these drugs fail to control the blood pressure, then it's time for the physician to refer the patient to a specialist who is an expert in controlling hypertension. With this, I would like to stop my short presentation. Once again, thank you for the opportunity.